These policies are absolutely good for flight attendants. We need to have everyone wearing masks. As we know, this is an issue where if we're all doing it, we're all safer. And so we need to be very clear with the traveling public about this. What is concerning to us is that this has not come from a government initiative, because it would be much more effective if this were a government regulation like we saw after 9/11. There were safety parameters put into place right after 9/11 to address the traveling public's concerns around security and safety following those events. In this case, we need to do the exact same. And if we are communicating from the government and from the industry as well, then that gives the people on the front lines a lot more backing to be able to make sure that this is implemented correctly and that it's not being put on our backs to be the enforcers.
Yeah. Dr. Merlino, how did you advise United? What did you tell them?
We told them that absolutely wearing masks for the passengers was the right thing to do. Look, masks protect us from each other, and we cover everybody up with a mask. We greatly reduce the potential spread of the COVID virus if people are shedding it. So this is about really creating an environment where we're decreasing the spread in a very confined space where we have difficulty with social distancing, which obviously you can't do on an airplane.
What about, Dr. Merlino, the lack of, say, a unified policy, if you will, the kind that Sara brings up?
Well, I applaud the airlines for taking the action to require it because, as Phil said earlier, the vast majority of people are wearing masks, but we really need to up the enforcement because everybody needs to comply. And I think it's absolutely the right thing to do.
Sara, we've come a long way in the last few months from almost nobody flying at all. Now you're seeing, as Phil just told us, added flights, a larger number of passengers. Can you take us into the mindset right now of the flight attendant on the plane and what they're thinking about, how they're feeling themselves?
Well, this is a very uncertain time. We're concerned about our safety and health, of course, and we know that we're putting ourselves at risk every time we come to work. These policies are giving us a lot more confidence. And what we're concerned about now is that we need to make sure that the traveling public is clear about these policies so that everyone gets used to a new way of flying and has confidence in buying those tickets again. And frankly, that we are putting in place policies across the board through the federal government to make sure that people are staying in their jobs, that we're addressing these unemployment numbers. We're concerned about an economy that doesn't support an airline industry as well. So we're concerned across the board. It starts with safety and security so that people understand that there's a confidence in buying an airplane ticket. But then we also need the means for people to be able to buy those tickets, too.
Dr. Merlino, it's an interesting question. Of all the safety precautions that one can take in getting on an airplane, I can't forget the story of a doctor who worked for NBC here in New York who got the virus, even though he said he followed all the precautions when he had to take a flight. Granted, this was maybe 6 or so weeks ago. He said he wore a mask, and yet he still caught the virus. What does that say about the safety of flying, even with the precautions?
Yeah, I think it's safe to fly right now, Scott, and I think it's important for people to follow the precautions because that will protect them. One thing that we learned by taking care of patients with COVID in hospitals is that we know how to keep caregivers and patients and visitors safe. And if we put together the right standards, we will protect people. You know, it's interesting because when you look across the country, flying was definitely down as a result of COVID, but there was still a lot of flying. There were still people on airplanes. We didn't have the safety precautions, and we haven't read about stories where clustering occurred on an airplane. So I think that most of the spread with COVID right now is happening out in the community. There's no direct evidence that people are getting infected by airplanes. I think if we put the safety precautions in place and people follow them, and as Sara noted, this is the new normal. We are now living in an environment with COVID until there's a treatment or until there's a vaccine. And it's incumbent on all of us to work together to follow the rules so that we're protecting each other. We know how to do this. If people follow the rules, if they wear masks, if they keep their hands clean, we can protect people.